I am Dr. Drake. I'm treating your son.
Oh, they told us to wait up here. They said they'd be bringing Jared.
Yes, he's having an MRI right now.
Well, is he all right?
The MRI should tell us the extent of the damage. He was conscious when he came in, though not terribly cooperative.
Welcome to my world.
Well, you know how boys are, Doctor. He's just going through a phase.
Somehow, when a boy who's 20 years old has hated us since he was 14, it's not a phase, Marion, and it's not a head injury. It's a character flaw.
I've ordered a blood workup to see if any drugs or alcohol were involved.
Should be an improvement.
No. Jared did no alcohol, no drugs. He was upset. We had a terrible fight. He jumped in his car and took off, and that was the last we heard until we got the phone call.
I'll do everything I can for your son.
Can you give him a personality transplant?
If I could, you'd go first.
Hi, sorry. Did Jack look sex? A little pain, you know, caused by a bullet in the plantar fascia? I mean, that's the price one pays for superhero status, which my girlfriend, the fair Lulu, can vouch for. See, we were first united when I had to rescue her from an evil band of mob warlords intent on unspeakable atrocities. You may have read about it.
Is any of this remotely true?
Every word.
Are you experiencing pain now, Mr. Jackal?
Not when you say my name like that, no.
Look, we're a little busy tonight, so if this is an emergency...
I'm in no hurry.
Okay, well, I guess you can wait here till the doctor's free, and I'll find your file and come back.
Okay.
You owe me, Mr. Jackal.
Yeah, how are you?
I'm fine, thanks.
You know, I was thinking maybe you and I should go somewhere and eat.
You already are.
Okay, really? It was a euphemism.
Thanks for the offer.
Yeah.
Maybe I'll take a rain check.
Dr. Julian. You. I heard you gave out free meds to patients.
Excuse me. Is there a problem?
The nurses here are not in the business of dealing drugs,
Whoa!
Dr. Julian.
Time out. Woo! If you're talking about my patient, Mrs. Storch, they're free. They're samples, and they're none of your business?
Finish what you were doing.
I was looking for you.
I think I have the wrong cubicle.
Elizabeth got called into OR and said I'd watch Jake. Ear infection. We're still waiting to see a doctor.
Aww.
Yeah. What?
Sorry, I'm staring. It's been a long time since I've seen you hold a baby.
Yeah.
I remember I used to hold Michael, and he was so tiny, and he thought he was gonna break.
Yeah, I was afraid he was gonna break.
I could tell you were a natural even back then. Something about how calm you are. I think babies really respond to it. But I can see that your technique has improved considerably.
Oh, thank you. You wanna hold him?
It's okay. He looks comfortable where he is. I was just thinking of Alan, actually, that head trauma that came in. It looks like it's a cerebral edema.
What do you mean, like mine?
Mm-hmm. And his parents, they are not handling it very well, especially the father. I mean, why can't men and their sons just admit that they love each other and get along?
It would be easier that way, that's for sure.
I'm sorry. That was totally insensitive.
No, you're absolutely right, actually.
It's easy for us to say, though, right? We're not parents.
Thank you. Well, your son developed cerebral edema, which is swelling of the brain.
Can you help him?
It's a complicated injury with a number of possible outcomes. Patients who regain consciousness often suffer personality change, sometimes radical.
Some good news at last.
Tom, stop it.
We should have disciplined him when it would have done him some good.
Tom, you never gave Jared a chance. You were so critical.
I had reasonable expectations.
You treated him like a disappointment.
He is a disappointment. He's hostile, he's rude.
Tom, he's your son. He's our son.
With all due respect, it would be a lot easier if you would just try and remain positive.
Dr. Drake, you have no idea what it's like to be responsible for a hostile, antisocial little punk. So just give us the facts, and we'll deal with it our way.
All we can do now is wait for your son to wake up. And we'll assess our options.
Hey, Dr. Boyd.
I'm fine. I'm doing the OR shortly.
Yeah, me too. I'm scheduled for your appendectomy. Layla.
Dr. Atta.
Hi.
Hi.
Man, I just came out of a crazy surgery. It was a gunshot victim with a blown artery. This guy was bleeding all over the place. It was...
Lucky you, huh?
Are you interested in surgery?
Isn't everyone?
You know, I can arrange for you to observe if you're interested.
Yeah.
Dr. Archer.
Yeah.
You're on the board for the emergency appendectomy with Boyd.
Right.
We stabilized that patient to take care of the critical patient in 4. There's no one else to cover anesthesia.
Yeah, I'll take it.
You must be dead on your feet.
I can go all night.
Look, I hate to ask you this. I mean, it's pretty ridiculous. I used to be able to go 36 hours without sleep.
Yeah, look, it's up to you. But you've got 2 hours until your appendectomy.
All right. Well, if I go to sleep, are you sure that I'm going to get up?
Look, it's not the length of time, it's the depth of sleep. The Diprovan makes 2 hours feel like 8. You'll wake up ready to roll. All right?
All right.
Look, come on, lay down.
All right.
People do it all the time, especially on the night shift. There we go. It's one of the perks of the profession. All right. Go. I am going to set you for 20 milligrams. Do not mess with the volume or you'll sleep for a week.
All right.
Got it, Dr. Boyd?
Yeah.
Okay. Pleasant dreams.
They said it was a blown artery.
Are you family?
Is he gonna live?
He came through the surgery very well.
This isn't the first time Javi's been shot, you know? It won't be the last either. I asked him to quit the gang when I told him he was gonna be a father. He said it's just who he is. So the hell with him.
Wait, please. Can you calm down and...
I'm not gonna have this kid so he can watch his father die. And grow up to get shot himself.